Am I crazy? During our lives, almost all of us go through this question at least once: am I crazy? Although, there is a self-doubt, but we carry on with life despite this nagging feeling. Are there some ways where I could get at least some idea of my sanity without lying on couch for indeterminate time? The answer possibly is knowledge. Remember the popular idiom? Knowledge is power. Also, let us not forget that little knowledge is a dangerous thing. But it is not dangerous if you understand its limitations. While we are on this point, a disclaimer is in order that we are not mental health professional or any kind of authority whatsoever. You must consult your own professional in the intended fields. All that we are doing is to share our own life's experiences that are loaded with plenty of unavoidable and painful, hard knocks. Ouch. After all, we all are forever students of life. Sorry, we never meant as an affront to any superachiever sitting on the highest pedestal by labeling them mere students. Continuing. It is important to keep in mind that psychiatric disorders are complex and multifaceted, and that many individuals may experience symptoms that overlap across multiple conditions. If you are concerned that you or someone you know may have a psychiatric disorder, it is important to speak with a mental health professional. Talking about psychiatric disorders is a massive subject. However, we would like to cover some basic ideas that might nudge you in the right direction in a healthy way, we hope. The information you get is simply basic, but you can amplify it by doing your own research that is highly recommended anyways. And of course, consult your own health professional. Let us start. Most common psychiatric disorders. Mood disorders. Types of mood disorders with real-life examples. Mood disorders are a category of mental health conditions that are characterized by persistent and intense changes in mood, such as periods of depression, mania or hypomania. Major depressive disorder, MDD. MDD is characterized by persistent feelings of sadness, hopelessness, and one no longer loves the activities that were once enjoyed. Real-life examples of MDD might include a person who has difficulty getting out of bed, or performing daily tasks due to persistent feelings of sadness, or a person who is unable to find pleasure in activities they once enjoyed, such as hobbies or socializing with friends. Bipolar disorder. Bipolar disorder is a mood disorder with episodes of depression and episodes of mania or hypomania. Manic episodes are marked by feelings of euphoria, high energy, impulsivity, and decreased need for sleep, while hypomanic episodes are less severe. Real-life examples of bipolar disorder might include a person who experiences a period of depression, followed by a period of high energy, grandiosity, and impulsivity. Persistent depressive disorder, PDD. PDD, also known as dysthymia, is a mood disorder characterized by persistent feelings of sadness or low mood that last for at least 2 years. Real-life examples of PDD might include a person who has felt down or blue for as long as they can remember, and who struggles to find joy or pleasure in life. Seasonal affective disorder, SAD. SAD is a mood disorder characterized by depression that occurs during the winter months when there is less natural sunlight. Real-life examples of SAD might include a person who experiences a significant decrease in energy, mood, and motivation during the winter months, but who feels better during the spring and summer. Premenstrual dysphoric disorder, PMDD. PMDD is a mood disorder characterized by significant changes in mood, energy, and behavior that occur during the luteal phase of the menstrual cycle. Real-life examples of PMDD might include a person who experiences severe irritability, depression, or anxiety in the days leading up to their period, which then subsides once their period starts. Anxiety disorders. Anxiety disorders with real-life examples. Anxiety disorders are a group of mental health conditions that are characterized by persistent and excessive worry, fear, or anxiety that interferes with daily life. Here are some types of anxiety disorders, along with real-life examples. Generalized anxiety disorder, GAD. GAD is characterized by severe anxiety, persistent and excessive worry about a variety of things, such as health, work, or relationships. Real-life examples of GAD might include a person who worries constantly about things that might happen in the future. such as getting sick, losing their job, or having a relationship end. Panic disorder. Panic disorder is an anxiety disorder characterized by recurrent and unexpected panic attacks, which are sudden and intense feelings of fear or discomfort that peak within minutes. Real-life examples of panic disorder might include a person who experiences sudden and intense feelings of panic, such as a racing heart, shortness of breath, and a sense of impending doom, while sitting in a meeting or driving a car. Social anxiety disorder, SAD. SAD is an anxiety disorder characterized by intense fear or anxiety about social situations, such as public speaking, meeting new people, or eating in public. Real-life examples of SAD might include a person who avoids social situations or feels extreme anxiety when they must attend a social event. Specific phobias. Specific phobias are anxiety disorders characterized by intense and irrational fears of specific objects, situations, or activities. Real-life examples of specific phobias might include a person who is afraid of spiders, heights, or flying. Obsessive-compulsive disorder, OCD. OCD is an anxiety disorder characterized by persistent and unwanted thoughts, images, or urges, as well as repetitive behaviors or mental acts that are performed in response to these obsessions. Real-life examples of OCD might include a person who feels compelled to wash their hands multiple times per day due to an intense fear of germs, or a person who feels compelled to check and recheck that the door is locked. Schizophrenia. Schizophrenia is a chronic mental health condition that affects a person's ability to think, feel, and behave clearly. Here are some types of schizophrenia, along with real-life examples. Paranoid schizophrenia. Paranoid schizophrenia is a type of schizophrenia in which the person experiences delusions, such as believing that they are being watched or followed, that others are plotting against them, or that they have special powers or abilities. Real-life examples of paranoid schizophrenia might include a person who believes that they are being spied on through their computer or phone, or a person who believes that they are being targeted by the government. Disorganized schizophrenia. Disorganized schizophrenia is a type of schizophrenia in which the person experiences disorganized speech and behavior, as well as flat or inappropriate emotions. Real-life examples of disorganized schizophrenia might include a person who speaks incoherently and is unable to complete tasks, or a person who has inappropriate emotional reactions to situations, such as laughing during a serious conversation. Catatonic schizophrenia. Catatonic schizophrenia is a type of schizophrenia in which the person experiences changes in movement and behavior, such as immobility, waxy flexibility, or extreme excitement. Real-life examples of catatonic schizophrenia might include a person who appears to be in a trance-like state and is unable to move or speak, or a person who exhibits repetitive and purposeless movements. Indifferentiated schizophrenia. Indifferentiated schizophrenia is a type of schizophrenia in which the person exhibits symptoms that do not fit into one specific subtype of schizophrenia. Real-life examples of indifferentiated schizophrenia might include a person who experiences a combination of delusions, disorganized speech, and changes in movement and behavior. Residual schizophrenia. Residual schizophrenia is a type of schizophrenia in which the person has experienced one or more episodes of schizophrenia in the past, but currently only exhibits mild symptoms, such as disorganized thinking or lack of motivation. Real-life examples of residual schizophrenia might include a person who has experienced delusions and hallucinations in the past, but currently only exhibits difficulty with organizing their thoughts or completing tasks. Attention deficit hyperactivity disorder, ADHD. It is associated with the following symptoms: inability to focus. A child with ADHD may have difficulty focusing on a task or activity for an extended period, which can result in poor academic performance or difficulty completing assignments. For example, a child with ADHD may struggle to stay on task during a class lecture, frequently interrupt others during conversations, or have trouble completing homework. Hyperactivity. Children with ADHD may demonstrate excessive levels of energy and restlessness. This may manifest as fidgeting, excessive talking, squirming in their seat, or interrupting others during conversation. An adult who frequently taps their foot or fidgets with their hands, and may feel restless or agitated when forced to sit still for extended periods. Impulsivity. Children with ADHD may act without considering the consequences of their actions. They may struggle to wait their turn, interrupt others, or act before thinking things through. This can lead to social problems, including difficulty making friends or conflicts with authority figures. An adult who interrupts others during conversations or meetings and may have difficulty controlling their emotional reactions. Forgetfulness. Children with ADHD may forget to complete tasks, misplace items frequently, or forget important details. This can impact their ability to complete assignments, attend to important details, and manage their time effectively. Difficulty with organization. Children with ADHD may have trouble organizing their thoughts, belongings, or schedules. They may struggle to prioritize tasks or manage their time effectively. This can lead to missed appointments, forgotten deadlines, and other problems. Eating disorders. Anorexia nervosa. An eating disorder characterized by an panic about gaining weight, a warped body image, and a limitation of food intake. Real-life examples might include a person who refuses to eat certain types of food, even if they are healthy and necessary for proper nutrition. A person who becomes obsessed with counting calories, weighing themselves frequently, and exercising excessively in order to maintain an extremely low body weight. Bulimia nervosa. An eating disorder characterized by episodes of binge eating followed by purging, typically through self-induced vomiting or laxative use. Real-life examples might include when an individual eats a large amount of food in a short time, often feeling a sense of loss of control during these binges. A person who feels guilty or ashamed after binge eating, and then purges in an attempt to rid their body of the excess calories. Binge eating disorder. An eating disorder characterized by episodes of binge eating, but without purging behaviors. Real-life examples might include a person who consumes large amounts of food in a short period of time, feeling a sense of loss of control during these binges, but does not engage in purging behaviors afterwards. A person who eats to the point of physical discomfort or pain and feels distressed or ashamed about their eating habits. Substance use disorders. Alcohol use disorder. A disorder characterized by excessive and problematic use of alcohol, despite negative consequences. Real-life examples might include a person who drinks heavily on a regular basis, often to the point of intoxication, and experiences negative consequences such as health problems, relationship issues, or legal trouble. A person who tries to quit drinking but finds that they are unable to do so, and experiences withdrawal symptoms when they try to stop. Opioid use disorder. A disorder characterized by problematic use of opioid drugs, such as prescription painkillers or heroin. Real-life examples might include a person who becomes physically dependent on prescription painkillers, and begins to use them in ways that are not prescribed, such as taking higher doses or using them more frequently. A person who turns to heroin or other illicit opioids as a way to cope with chronic pain or emotional distress, and finds themselves unable to stop using despite negative consequences. Stimulant use disorder. A disorder characterized by problematic use of stimulant drugs, such as cocaine or methamphetamine. Real-life examples might include a person who uses cocaine or other stimulants to boost their energy or stay awake for long periods, and finds that they are unable to control their use despite negative consequences such as financial problems or health issues. A person who becomes addicted to prescription stimulants, such as those used to treat ADHD, and finds themselves unable to function without the drug. Personality disorders. Personality disorders are characterized by long-standing and inflexible patterns of behavior, thoughts, and emotions that deviate from cultural norms, and cause significant distress or impairment in daily functioning. Personality disorders. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is published by the American Psychiatric Association, recognizes 10 specific personality disorders. Borderline personality disorder, BPD, or Emotionally unstable personality disorder, EUPD. It is characterized by increased impulsivity, instability in relationships, self-image and affect. Someone with BPD may have intense, unstable relationships with friends, family, or romantic partners. They might struggle with emotional regulation, have a fear of abandonment, and engage in impulsive or self-destructive behaviors like substance abuse, binge eating, or risky sexual behavior. Paranoid personality disorder. This is characterized by a pervasive distrust and suspiciousness of others, as well as a tendency to interpret others' motives as malevolent. A person with paranoid personality disorder may have a pervasive distrust and suspicion of others and may interpret benign actions as hostile or threatening. They may also be guarded or secretive in their interactions with others. Schizoid personality disorder. This is characterized by a lack of interest in social relationships, a preference for solitary activities, emotional detachment, and restricted emotional expression. Someone with schizoid personality disorder may have a pattern of avoiding close relationships and social interaction. They may appear indifferent to praise or criticism and have a limited range of emotional expression. Schizotypal personality disorder. This is characterized by odd or eccentric behavior, unusual beliefs or magical thinking, and social and interpersonal deficits. Someone with schizotypal personality disorder may have a pattern of unusual beliefs or experiences, such as magical thinking or unusual perceptions. They may also have difficulty with close relationships or social interactions. Antisocial personality disorder, ASPD. This is characterized by a disregard for and violation of the rights of others, as well as a lack of empathy and remorse. Someone with ASPD may exhibit a pattern of disregard for others' rights and safety. They might engage in behaviors like lying, stealing, or manipulating others for personal gain, or engage in criminal behavior like theft or violence. Histrionic personality disorder. This is characterized by excessive emotionality and attention-seeking behavior, as well as a need for approval and praise from others. A person with histrionic personality disorder may have a strong desire to be the center of attention and may use dramatic or attention-seeking behaviors to achieve this, such as exaggerated emotions or physical appearance. Narcissistic personality disorder, NPD. This is characterized by a grandiose sense of self-importance, a lack of empathy, and a need for admiration from others. A person with NPD may have an inflated sense of self-importance and a deep need for admiration and attention. They may lack empathy for others, be arrogant, and expect to be treated as special and unique. Avoidant personality disorder. This is characterized by social inhibition, feelings of inadequacy, and hypersensitivity to criticism or rejection. A person with avoidant personality disorder may have a pervasive fear of rejection or criticism that can lead to avoiding social situations, feeling lonely or inadequate, and being excessively shy or anxious. Dependent personality disorder. This disorder is characterized by a strong need for social support that is pervasive need to be taken care of, a fear of separation, and a submissive demeanor, which can lead to unhealthy, clingy behavior, and codependent relationships. Someone with dependent personality disorder may have a strong need to be taken care of by others, and may rely on others for decision-making, self-esteem, and daily tasks. They may be afraid of being alone or abandoned. Obsessive-compulsive personality disorder, OCPD. This is characterized by a preoccupation with orderliness, perfectionism, and control, as well as a rigid adherence to rules and routines. A person with OCPD may have an intense preoccupation with order, perfection, and control, to the point where it interferes with their ability to function in daily life or form close relationships. Diagnosis of personality disorders. It's important to note that a diagnosis of a personality disorder requires a pattern of behavior that is pervasive and enduring and associated with significant distress or impairment in functioning in social, occupational, or other areas. Dissociative identity disorder, previously known as multiple personality disorder. It is primarily characterized by at least two personalities. Disruptions in a person's sense of identity, memory, and consciousness, rather than by patterns of behavior or personality traits. Did share some similarities with personality disorders. Hello. We are finishing our journey together. We hope you gain some knowledge. We remind you again to consult your healthcare providers if you have questions or concerns about your health. We just provided you with some information that we cannot guarantee of its accuracy. If you enjoyed the video, please subscribe, hit the like and notification buttons. Thanks for watching.